Sometimes people ask me, why is law, justice, and human rights have anything to do with public health? And my answer is usually everything. Because if you think about health, you think firstly about your own right to health. And the World Health Organization Constitution, United Nations treaties, constitutions of many countries around the world include the right to health, the right to a safe environment, sometimes the right to clean water or good food. So these are all kind of basic needs that are really critical for a population or an individual to be healthy. And that's the other thing about human rights. Human rights, protect individual liberty, autonomy, freedom from torture, and also anti-discrimination and the right to justice. So if you think about health, the environment, food, water, justice, if you don't have dignity, justice, and health, it's very, very hard to lead the kind of life that is vibrant and wonderful. And so what your mother told you is true. If you've got your health, you've got everything.
It's been an inspiring evolution of human rights over the last 70 years since the Universal Declaration of Human Rights. Human rights law really only becomes a focal point of global health in the aftermath of the Second World War. And drawing on the UN Charter, the Constitution of the World Health Organization, nations would come together in 1948 to declare a common standard of achievement for all people and all nations in this Universal Declaration of Human Rights. Rather than laying out an expansive human right to health, the Universal Declaration of Human Rights focuses on a standard of living adequate for health and well-being. This standard of living for health and well-being would encompass both a state obligation for medical care, but also a focus on a wide range of underlying determinants of health. As these underlying determinants of health would be codified under international law in the aftermath of the Second World War, the Cold War would serve in many ways to hobble the expansive definition of the right to health first laid out in the Universal Declaration. With the 1966 International Covenant on Economic, Social, and Cultural Rights, limiting the right to health to a right to the highest attainable standard of health. In the midst of the Cold War, the United States and the Soviet Union would come at the right to health with very different ideological definitions of what that right to health included. And with the right to health serving as a Soviet basis for critiques of capitalist inequalities in health, the United States would push back against an expansive definition of the right to health in this International Covenant on Economic, Social, and Cultural Rights. And yet, after this low point in 1966, in the 1970s we see civil society, the global South, nations coming together around a more expansive vision of the right to health, as WHO would be seen to have the normative legitimacy and authority to declare these obligations. We would see in the 1978 Declaration of Alma-Ata a revitalization of the definition of health in the WHO Constitution, a programmatic implementation for realizing that right under national health policy. Although the Declaration of Alma-Ata would never become part of international law, we would see human rights thrive in the 1980s as civil society embraced a rights-based approach to health within the World Health Organization as a way to respond to the expanding HIV/AIDS pandemic. With this foundation of human rights and global health, the end of the Cold War would provide an opportunity for revitalizing obligations under international law. And we would see in 2000 the UN Committee on Economic, Social, and Cultural Rights declaring in General Comment 14 an expansive vision of the right to health that encompasses a wide range of underlying determinants of health, a vision in line with the 1970s WHO Declaration of Alma-Ata, and providing a foundation for considering both individual medical care and a wide range of social, economic, and political determinants of health, laying a foundation under international law for advancing public health into the future. This shift toward implementation is acknowledged for the first time in 2005, with UN Secretary General Kofi Annan standing before the UN Commission on Human Rights and saying that the era of the declaration is over, that we are now beginning an era of implementation, recognizing the ways in which human rights need to be more than paper documents. They need to be realized in the lives of people throughout the world. Following this encapsulation of an era of implementation, Kofi Annan seeks to mainstream human rights across the United Nations system, recognizing the ways in which every part of the United Nations system needs to implement human rights in its policies, its programs, and its practices. And it's this implementation process that is in many ways so unclear. We know what it means to put treaties into law. We know very little about what it means to translate those international legal obligations into policies, programs, and practices that can realize the highest attainable standard of health for people throughout the world.
You know, governance sounds like a very cumbersome word, but really what it means that national governments have to govern in a way that's efficient and fair. And so governments should follow what Ben and I call principles of good governance. Things like no corruption, transparency, setting clear targets, monitoring those targets, inclusive participation so that you include civil society and other people who are affected, and then ultimately accountability. So these are the hallmarks of good governance, and governments around the world should do that, and we know that many governments don't. They persecute civil society, they violate the freedom of expression and the free press. And they're hardly accountable, and many of them are corrupt. So we need to do a lot at the national level. But also governance is at an international level, because if you think about the United Nations, UNICEF, and of course the World Health Organization, we want them to be governed well, and we want them to be governed by the same principles of good governance that I talked about. And what's really, really important, it focuses on good governance. It has to really make a priority for health and human rights, because those are the two underpinnings of prosperous societies with good well-being. And so good governance at the local level, the national level, and the international level are all critically important for health and human rights. The WHO was the actual first specialized United Nations agency that was formed when the United Nations was formed. And that constitution does two major things, among many others, but one is it dedicates the organization as the global health leader. And it defines health very, very robustly and broadly. And then secondly, it talks about rights and human rights, and particularly the right to health. Now, WHO, to be very, very honest, has not always been a champion of human rights. It's not always been WHO's fault. There have been many powerful countries that have tried to stop WHO from being a human rights champion. But it is in WHO's DNA. It's in their constitution. And it's critically important. So things like the right to primary care, the right to universal health coverage are all central to the World Health Organization. And now there's a new Director General, Dr. Tedros, who's focusing on human rights. and particularly celebrating the fact that WHO can return as a leader of human rights as we celebrate the 70th anniversary of the Universal Declaration of Human Rights. So there's so much optimism and so much to look forward to WHO's leadership in human rights, but we have to hold WHO to account.
Despite the expanding scope of scholarship around health and human rights, almost all of this scholarship focuses on national governments, ignoring the wide range of international organizations that seek to implement human rights in their mission and in the way they carry out that mission. And so our volume is the first to systematically examine human rights and global health governance, recognizing the ways in which human rights are crucial, not just in the human rights system, but in the wide range of organizations, with the legitimacy, the competence, and the capacity to implement human rights as a basis to improve global health. In focusing on these issues, we begin in the human rights system, but we think about a much larger set of international organizations. From the World Health Organization's constitutional obligation to realize a human right to health, to the wide range of international organizations with the capacity to address underlying determinants of health, whether the health of the child in UNICEF, occupational safety and health in the International Labor Organization, UNESCO's focus on education and science as a foundation of health. We also recognize the ways in which international economic governance is crucial in realizing human rights for global health, with most of our funding agencies beginning to focus on the ways in which their funding of global health initiatives can either realize human rights or infringe human rights in achieving public health outcomes. And so as we begin to see the wide array of organizations inside the human rights system and outside of the human rights system, we recognize that different institutional factors can support mainstreaming of human rights or inhibit mainstreaming of human rights. Across the organizations, we begin to focus on the ways in which leadership can be crucial within the organization and among member states. We begin to focus on the ways in which civil society can become crucial advocates supporting human rights from the outside. We can think about the inside of the organization and the technical staff either becoming champions of human rights or limiting opportunities to advance human rights in their work. And we can begin to think about the ways in which the human rights system of the UN coordinates with these organizations to advance the work of these organizations and assure that there is collaboration and partnerships that are necessary to advance human rights in global health.
You know, our aspiration and our dream is a world that's dedicated to the human rights of every person on the planet. And that includes their right to health, but it also includes equity and justice. And we all know that we're a long way from that. We have governments that torture people. We have conflict all over the world. We have mass migrations and refugee crises. And so we need to do so much more to defend and protect human rights. So what can we do? Well, my experience is, and it goes all the way back to the AIDS pandemic, is that you need bottom-up social mobilization. You need to have the voices of the people rise up and demand their human rights. That's critically important. I was one of the early pioneers in the AIDS movement, and I admired all of the people around me because AIDS changed the world. There were AIDS advocates that just literally would not let governments like the United States or international institutions like WHO ignore the needs and the rights of persons living with HIV/AIDS. And so we need to use that model of bottom-up civil action where people demand their rights. And you'll be surprised if you have a bottom-up revolution, then it influences governments and it influences the World Health Organization, the UN, and other international institutions. And so what I've been saying all along, and what we say in the book, is that you have to hold actors to account for defending and respecting and promoting the right to health and all human rights. Because in the end, if you think about any human being, we all yearn for our health and we all yearn for justice and human rights. It's a universal aspiration, and we have to make sure that governments and international institutions respect our demand for the right to health.